The American Gastroenterological Association (AGA) has issued new clinical practice guidelines to address the prevention and management of hepatitis B virus (HBV) reactivation. These updated guidelines are timely, considering the advancements in immunosuppressive therapies and the increased risk of HBV reactivation associated with these treatments. HBV reactivation occurs when the virus, which remains dormant in the liver of affected individuals, becomes active again. This can happen in patients who are either positive for the hepatitis B surface antigen, HBsAg, or have antibodies to the hepatitis B core antigen, anti-HBc. Reactivation is most commonly triggered by prolonged immunosuppression, often due to medications such as B-cell depleting agents, e.g., rituximab, or underlying diseases. The new guidelines emphasize the critical need for healthcare providers to closely monitor patients who are at risk of HBV reactivation. The guidelines categorize patients into low, moderate, and high-risk groups based on their likelihood of reactivation. For high-risk patients, the AGA strongly recommends antiviral prophylaxis to prevent HBV reactivation and associated complications. Since the publication of the first AGA guideline on HBV reactivation prevention and management in 2014, there have been significant developments in immunosuppressive therapies. New treatments such as immune checkpoint inhibitors (ICIs), anti-interleukin-1 therapies, chimeric antigen receptor T-cell (CAR-T) therapies, and Janus kinase JAK inhibitors have been introduced and are now widely used in clinical practice. The updated guidelines are based on a comprehensive review of existing evidence, utilizing the grading of recommendations assessment, development, and evaluation grade methodology to formulate evidence-based recommendations. The primary goal of these guidelines is to balance the benefits and risks of antiviral prophylaxis and monitoring strategies, ensuring optimal care for patients at risk of HBV reactivation. These guidelines are especially important for frontline medical professionals, including gastroenterologists, oncologists, and rheumatologists, who frequently encounter patients at risk of HBV reactivation. By providing clear and evidence-based recommendations, the AGA aims to improve the quality of care and patient outcomes in this vulnerable population. In summary, the updated AGA guidelines for preventing and managing HBV reactivation highlight the importance of proactive monitoring and antiviral prophylaxis for high-risk patients. As the landscape of immunosuppressive therapies continues to evolve, these guidelines will serve as a valuable resource for healthcare providers, ensuring that patients receive the best possible care.